Hey everybody, Dr. Tammy here. I have had so many questions lately about weight loss medications by prescription. And people are coming in, they're hearing on social media, on TikTok, people are losing tons of weight. And I think I just want to first dispel the myth that obesity is not a disease. That obesity is some sort of internal flaw, or it's a willpower issue, or that obesity is people being lazy, or just all the things that we think when we see obesity and relate that. Obesity is a disease, and some people may disagree with me, but more and more evidence is coming out that obesity is a disease, and there's a very big genetic component. And I have worked with women and men with hormones for over 20 years, and so I can tell you that what I've seen when people come in and they say, I do eat clean, I do exercise, it's very frustrating for those people when obesity is a disease. Now, if you're eating junk and you're very sedentary, that's on you. But there are some people, and you see families that are all obese, and you just know there's a genetic component to that. And yes, our food supply is crap, and there are lots of components that can lead to the obesity problem. And I will say, when you say problem, what is the problem? 1 out of 3 Americans are obese. That is huge. 1 out of 3 Americans are insulin resistant, which is a hormone that can really affect your sugar storage. So we're dealing with an epidemic, a disease that is killing people, and it's leading to heart disease and all sorts of things. So without going into too much about it as a disease, I just want you to start shifting your thinking, because I'll tell you that I have seen the frustration, I've seen the tears, I've seen doctors just tell people, you need to exercise more and eat less. And for some people, that just doesn't work. So if you're one of those people that are really frustrated and hit the wall, you might be considering weight loss meds, and you might not know what route to go. And there are lots of these online programs and membership programs, and you have to be really careful with those, because they'll charge you like $100 a month. That doesn't include your meds, that doesn't include your doctor visits, and they're doing it all online. So they don't know you, and they don't know, potentially how you're interacting with things. So you have to be really careful when you go with those online programs. I'm not saying that's not an option, because doctors' offices are very busy, and I get it, and it's so convenient to do things online, but just be careful when you do that, and look for the fine print. I've looked at some of those sites, and the fine print is almost like grayed out where you can't even see it. So be careful as you're considering those things. Okay, so let's say that you do decide you have a genetic thing, and I'll tell you something really interesting that I've been reading about lately is rare genetic obesity issues. I don't think they're rare, and I've seen genetic issues. I do a lot of genetic testing in my office, as well as hormone testing. But what I have seen is these things that we've called rare genetic disorders like MTHFR and things like that. Over time, as people start coming out and they start doing the testing, we find out, when we get over the stigma that obesity is laziness, when we recognize it as a disease and we start testing for things, we see that there are these issues. And so there are actually genetic tests that you can do for obesity. And if you find that's the case, there are very specific medications, and there are new ones coming out all the time, and it's very fascinating. And I try to avoid big pharma, and so I'm going to tie this up with a big bow about things that you can do naturally to avoid having to use these meds and go to the doctor's office and things like that. So again, you're never going to be able to avoid diet and exercise. That's all going to be part of it. But if you feel like chemically, genetically, something is an issue, and just like you might have high blood pressure and need blood pressure meds, or you have an infection and need antibiotics, this could be an issue that does need medications, and it's at least worth a conversation, instead of just shutting that off and saying, hey, that's just, it's, maybe laziness or something. So anyway, so on TikTok, in social media, we are just blowing up with all these injectable diabetes meds. And so you've probably heard of Wegovy and Ozempic, and people are losing massive amounts of weight. And I will tell you that I have several patients who are on this medication. And it's kind of funny, I'll just tell you a quick little story about it. It actually came from salamander saliva studies, and so I call it lizard spit. But it's not lizard spit exactly, but it's a chemical in there that works on something called GLP-1 agonist. And some of these work a little bit differently, and so their mechanism of action are a little bit differently. And you don't have to know this, but it is GLP that is the hormone system that it's working on. And so These different names are basically an injectable once weekly. They do have side effects. They can cause nausea, but all sorts of other dizziness, all sorts of things they can cause. But if you do have insulin resistance, which 1 out of 3 people do, this could be a great option for you. And I have patients losing, I'm not trying to get y'all excited about this or run to the doctor to try to get on this. And there's actually a nationwide shortage, which I'm not sure I understand. That's probably all the TikTok people touting it. But I have patients who have lost 15 to 20 pounds a month, which is very significant. And of course, I counsel them along the way about the natural things that they need to be doing so that they can maintain that. Because you don't want to take an injection once a week for the rest of your life. But I find that once people can get these hormonal issues under control and they start doing more natural things, that they can maintain that. So it's just an option if that might be an issue for you. So you'll hear the words Ozempic, Saxenda, Mounjaro, Wegovy. So those are all those. And again, that does take a prescription. And right now, if you don't have diabetes, it's really hard to get it without insurance. It's like on back order everywhere. And even with insurance, sometimes if your insurance doesn't cover it, it's like $1,200 a month. So this is not just something you're going to run and get a prescription for easily or cheaply. Okay. So of that class, that's just one class. And it's, like I say, it's getting a lot of awareness right now. Okay, so this mostly works through the pancreas, insulin, and glucose as hormones. I got to get my nerdy hormone discussion in there. But the other weight loss drugs usually work through the brain. And now, before you stop and think, well, it's all in your head if you're overweight, it is. But it's not the laziness or, procrastination or, those kinds of things that are in your head. What I'm talking about is neurochemicals that have responses like dopamine, serotonin, norepinephrine in the brain. And when those are out of balance, maybe that's from stress or post-traumatic stress disorder or any other reactions that you've had in your life or any sort of anxiety, depression adds to that. These might be good medications for you, especially if you have something I call evening eating disorder, where all you want to do is eat everything in sight and it's just a stress reaction, or you find that you're stress eating. These could be great medications for that. So there is a very interesting one, and it's in the research stage, and it's in a class of medications called peptides, which peptides are naturally occurring proteins in the body. And, there's so much cool stuff about peptides. But this peptide is still under experimentation, if you will. It's under investigation. So hopefully it will come out very soon. But it was actually created. And a lot of these medications are side effects of weight loss. And I always say weight loss is a side effect of being healthy. So if there's an underlying genetic or metabolic or hormone or amino acid peptide issue, something going on, then you might have an issue that could be causing some sort of brain dysfunction that could be causing your brain to tell you to overeat or to stress eat as a reaction or some sort of self-soothing behavior. So this is called tesofenacine. We always have these big crazy names for stuff, right? That's just what we do in medicine. We have these big fancy names just to make us all sound smart, but don't be fooled by that. Okay, so that's kind of on the back burner, but it is actually being studied for Alzheimer's, which is fascinating, and Parkinson's. And if you know anything about Parkinson's, you know that's a dopamine issue. So as a side effect, in fact, as they were using that medication for people, they actually had to stop that medication because people were losing so much weight, too much weight. And so that's sort of on the back burner, so keep that one in mind. Okay, the other one is Contrave, and this has been around for a while. This is a kind of expensive one, and it's so frustrating because insurance companies call weight loss meds vanity drugs, and so they don't want to pay for them. So this is not vanity. Having a heart attack, having a stroke, having diabetes is not vanity. All those are diseases that are part of this disease process. And so it's very interesting. Contrave was quite expensive when it came out. We're talking like $300-400 a month, not quite like the GLP-1s, but pretty expensive. So I did my research and I found that it's a combination of something called naltrexone and Wellbutrin. And the generics of those separated out are very cheap. So you can write for those two very inexpensively, like probably less than $15. So that's a nice option if you want to try the Contrave. And again, those might be things that you might have to use longer term. And we might be looking at more of, my experience with those has been probably about a 5% weight loss when you're talking about 300-pound person. You do the math, 5%. These GLP-1As are more like 15 to 20 to 30% weight loss. So very, very significant. So these are really quickly moving to the top of the list. Okay, and then phentermine, I'm gonna have to move over here just a little bit probably. Phentermine is a stimulant. It's been around for a long time. It came from the combination of what was called fen-phen. So if you've been around the planet a time or two, you know that fen-phen was causing heart attacks and all sorts of issues. So they had to pull fen-phen off the market, but now we have phentermine. And so phentermine is a stimulant. It's a amphetamine basically, and it's not good for long term, but in people who have healthy adrenals, it can help with appetite suppression and with energy levels and get you more motivated to exercise. And it can pump up the metabolism just a little bit. Metabolism itself is a very fascinating conversation, and it's a little bit out of scope of what I'm trying to be brief here with today, but it's a very complicated reactions that happen in the body. So metabolism, when we say it fires up the metabolism, that is so extensive. I mean, you can't even like summarize that in like 5 or 10 minutes here. So, okay. So there's phentermine, and it is a controlled substance. So it's very hard to get your doctor to write for it, and especially any more than just a couple of months, rightfully so, because it is potentially very easily abused. So you do want to be careful with that one. The next one is Topamax. That's a seizure medication. That's what it was approved for, right? We use some things off label. But what they found was people on this medication lost weight. Again, a side effect of these drugs is weight loss. So that's what we're maximizing here. And so it quickly got the name with my patients, and you know, it's kind of a thing. They called it Dopamax, DOP instead of TOP, because it can cause a little bit of kind of goofiness, which you think I'm on Topamax, right? Because I'm goofy sometimes, but I'm not. But so yeah, so the dopiness is just kind of a nickname I got. It's usually self-limited, but you know, people who are in type A jobs and high stress, that's probably not a great option for them, because you have to be on your A game, right? You know, if you're willing to kind of work through the side effects for a few days or a week, and you don't have a whole lot of outside the home responsibilities, that kind of thing, and not everybody gets that side effect, so it might be an option as well. And then diuretics, because and here that's just an easy cheat, because sometimes what you have is water bloat. And so actually it's very counterintuitive. Drinking more water actually helps with water bloat. And so I know that's crazy, but it's a thing, I promise you. So anyway, so diuretics can help, especially if you have a lot of fluid retention and you're extremely overweight, and if you have any blood pressure issues, because it can lower your blood pressure a little bit too. So if you have weight related hypertension or something like that, it's a great add-in. It's not something I would just put people on water pills just because it's some skinny girl coming in wanting to lose weight. That's just not good. Okay, and then another one is metformin. That is a diabetes med that sort of ties into what we talked about with the pancreas meds, the GLP-1As. And I've used that for years and years and years, and it helps sensitize your insulin, and it's very effective, and it stimulates something called AMPK, which is a energy regulator in the body. So talk about metabolism, that's the thing. And if you go to my supplement company, carbmelt.com, at the bottom of my page, I have blogs that I do pretty much almost like every day, and I have tons of information, and you can go back through the archive. And just 2 days ago, I did one on a cheat sheet for AMPK stimulation. So just fascinating stuff, and I just nerd out on that, but I try to keep things simple because it's easy for me to nerd out on that stuff. Okay, so metformin, it's usually a blood sugar, insulin resistance, or diabetes oral medication. It's a pill, and I will tell you, I don't know if I mentioned it, but those GLPs are injectable. So and then the rest of these are all oral or pill form. Okay, and so metformin works very well. Side effects happen with all these, whether it's jitteriness from the stimulants, whether it's, kind of different brain chemistry interactions if you take these other ones. And metformin, because it blocks the absorption of sugar in the stomach, it can cause GI side effects, which can be not fun. And usually these side effects will dissipate, but, these things are fun, so. Okay, thyroid. I do a lot of hormone testing in my office, and thyroid dysfunction, if you are overweight, you have a thyroid issue, case in point. But doesn't mean that you need to go to the doctor and see me. Now, you may need to see a doctor for thyroid issues. I'm not saying that. But a lot of thyroid issues are related to obesity. So thyroid issues are a problem with obesity, and without going into the mechanism of action of that, a lot of times the thyroid will correct if it's not a real severe problem when you fix the obesity. Okay, so thyroid, even in low levels, sometimes I'll treat what I call subclinical hypothyroidism, and thyroid and metformin together have a ton of research for stimulating AMPK, which is the temperature metabolism regulator of the thermostat of your body, basically. And if you've ever felt like your pilot light is out, like you're just stumped and stopped with your metabolism, stimulating AMPK, lighting that pilot light can really be that jump start that people need. Okay, and so I promised you that I would kind of tie up here in a pretty bow natural things that you can do. And I will tell you that low carb is very it's essential, and that's why some of these pancreas insulin medications work so well, because if you can limit your carbs. But a lot of times people who have some of these both brain and hormonal endocrine dysfunctions, they can't get past these sugar cravings, the sugar crashes. So there's all sorts of things that happen. So if you don't want to go on a prescription or you want to do things more natural, I just am super excited because I know that people can diet and can exercise, and that will stimulate AMPK and can start with great results. And people sometimes they'll fuss on my social media and they'll say there's no substitute for diet and exercise, and I get that. Trust me, more than anybody, working with patients for over 20 years doing weight loss pretty much primarily in hormones, I get that. But sometimes people need help, and if you have a medical, hormonal, amino acid peptide chemical issue or genetic issue, you need help with that. And that's not about being weak or being lazy. You might need help with that. So my supplement company, I have something called Carb Melt and I have something called Belly Melt. They work differently. Carb Melt works on insulin, and Belly Melt works on fat absorption and dietary fats and metabolism, and kind of, we call it a fat burner basically. But so I'm not trying to just sell you supplements. I'm trying to explain that obesity is a disease. And even if you're just 5, 10, 15 pounds overweight, that can be enough to drive your blood pressure up. That can be enough to drive your cholesterol parameters up. I mean, there's so many things, your insulin resistance to diabetes. So a lot of times just losing 10 or 15 pounds can get you off pharmaceuticals like blood sugar meds and things like that. And again, I'm not your doctor. This is just information. I'm not your doctor. I'm not telling you to stop meds or do anything. But that, kind of that natural approach can be a really important, essential way to do things. So I created these supplements. I formulated them myself. I went to the manufacturer. I told them everything I wanted in it. And the beautiful thing is there are supplements like berberine and quercetin and white kidney bean and fiber. And those are all ingredients that I formulated based on my experience in these supplements. And so it was really born out of trying to help people, because they were like, what can I do? What can I do naturally? Because I try to be more of a functional medicine doctor. And what can I do naturally? And so I, over the years, have seen the things that work and that don't work. And I've seen what quality stuff does and what not quality stuff does, and what people waste their money on, and what they tell me anecdotally, and what I see on the scale when they come in. So it's just, it's been a fascinating ride for me. And I always address underlying hormone issues or depression, anxiety, all those things. It's all about relationship with you and your doctor. And if you have a disease like obesity, this is a serious condition and not something that you need to just blow off. And this is not about being selfish or, I got to take care of my kids first, or I'm not a priority, or whatever your thoughts are with that. This is, you want to be around for your family, and you might not be if you don't treat obesity seriously. So again, not trying to sell you supplements here, but I do passionately believe in what I do. And it's funny because people ask me, do you take, your supplements? And I'm like, yes. And we had a back order, we had a supply chain issue, and we were out for almost 2 months of our Carb Melt. And it was just panic state for me, because my insulin levels, just myself, I'm just, being real with you, my insulin levels were almost 75, and they should be less than 10. My insulin resistance was terrible. I had sugar crashes all the time, brain fog. It was awful. And so when I formulated this, it was like such a breath of fresh air. So when we ran out, I was really anxious, and I was just holding my breath till we could get it back in. And not just because it helps a lot of people, but just because I'm super passionate about it. And, I'm scared, like, if we ever ran out or had any problems getting it, because my insulin levels stay down around 2 now. So again, went from the 70s to, it's supposed to be less than 10 fasting, and they stay around 2 now, and I don't get those sugar crashes. So it's just, it's just been a real miracle for me. So that's something you want to check out. It's carbmelt.com. I do highly recommend, though, that if you are even 5 pounds overweight, don't let it get out of hand. It's something to look at, and it's not being selfish. It's being around for your family. And especially after menopause, this goes nowhere good, because when you have hormone issues, it just gets worse. And I see women who gain up to 15 pounds a year after menopause because they're not addressing these issues. And, the medical world just kind of blows you off, and it's terrible, especially for women with hormones. So be your own advocate, get the care you need, and I just want the very best for you. I love you all very much. I hope you have a beautiful weekend. Looks like it's going to be nice. So get out there and get some exercise, and just be the best you can. Mwah.